The Patcha Foundation was founded in 2008 by my mother, Mrs. MAURITIA Patcha, after her initial diagnosis with breast cancer had been botched up, and she felt the need to educate women about how best to empower themselves and take charge of their health, and particularly about how to recognize some of the signs and symptoms of cancer to reduce the risks. So in 2008, my mother had been diagnosed with breast cancer, and in the process of her diagnosis, we realized that there were very few resources available. Not much was known about the disease, and her diagnostic process was really cumbersome, and it was completely botched up, in fact. And so witnessing her journey and the effect of that delayed diagnosis and possibly delay in treatment, the effect of that on her subsequent recurrence and death from cancer has inspired us to try to give back to the community, to educate people about cancer, to teach them how to recognize some of the signs and symptoms of the disease. And their effort really is to help to prevent more deaths and illness due to cancer. When my mother started the foundation in 2008, we held our very first workshop in Goya, and at that workshop we only had about 200 people, and I think just one man was in the audience. Subsequently, we have gone with the medical missions. We've gone to, I believe, 4 or 5 different regions now, and this year we were in the West region for the second time. We were initially in Chan a couple of years ago. We came back to BANA, BANKA, BAGULAP and BANA this year, and our goal is to spread cancer awareness and reduce the burden of cancer in Cameroon, one region at a time, and I believe that we're on the road to accomplishing that. The medical missions have really grown beyond our expectations, and we are very blessed to encounter as many people as we do along the journey who want to be a part of this life-saving activity. In this mission in the West, we had close to 140 volunteers, so many specialists. We had cardiologists from Shisong, we had the surgical teams from Presbyterian Hospital Dogbati, and also from Ascovin. We had Prevent Blindness International, who handled our ophthalmology services. We had dentists coming from Howard University and also locally from Cameroon. We had the Cameroonian Nurses Association, who were providing triage services. Also, Momex Foundation, for the first time, was able to provide screening for hepatitis and HIV and malaria. We had as well, of course, so many other support staff handling logistics. With a mission like this, I'm sure you can imagine how vast the needs are, not only to take care of the patients, but also the needs of the volunteers on the ground. And we're just so pleased that the community has come together and provide those services for us. This year we saw over 4,000, I believe the numbers are over 4,600. We had 378 received cardiology services and got preliminary treatment for cardiology ailments.
There are many patients really with severe hypertension. It seems as the very first time that really they are presenting with this type of figures, and they didn't know that they were having high blood, meaning that this mission is really having a positive impact on the populations of Cameroon, and precisely populations of this area.
We had 427 total go through the dental service, and of course we had the 3 dentists on staff.
Most people have a lot of broken down teeth. Most people need extractions, and most people need periodontal, most people have periodontal disease and need scaling and root cleaning. That's the common thing. The fact that they don't see a dentist at all and the many years of accumulation of plaque and tartar results in bone loss and a lot of need of hygiene. So hygienists are much needed in this country, or oral surgeons for third molars. That's the most common #1 cavity on third molars.
Cameroon Baptist Convention Health Services provided our cervical and breast screening. We had 778 women who were screened, with 37 or 39 receiving treatment for precancerous lesions.
La Fondation Patcha, et qu'ils font pour nous, c'est bien. C'est bien pour la santé et qu'il ne faut pas que les gens aient peur de venir faire des examens parce qu'il y a certaines dehors qui ont peur qu'elles peuvent mourir. Bon, il faut affronter.
Thank you, mom. Thank you. The good bless for you. All people for you. My name is Jungle Clothing. Je suis camerounaise et je suis Bafan. Donc, je vous ai suivi à BANA, je vous ai suivi à BANKA et maintenant je vous suis encore à Baganté parce que je voulais vraiment faire tous mes examens. J'ai fait mes examens, je suis entièrement satisfaite. C'est-à-dire que c'est la grande première dans le Hong Kong. Nous sommes à l'ouest, je vais dire, donc nous sommes très satisfaites. Et je vous en suis vraiment reconnaissante et je vous remercie énormément. C'est-à-dire que toute la population de Bafan vous remercie. Par la grâce de Dieu. C'est-à-dire que cette association va en avant, va de l'avant. Grand merci, grand merci, grand merci. Et mes examens sont négatifs, donc je suis très contente, je suis très fière de moi.
Vital Signs saw 5,100 people, over 5,100 people receive blood pressure and blood sugar screening, as well as counseling, lifestyle counseling.
L'autre fait l'exercice qui consiste à regarder la couleur de vos urines quand vous allez faire pipi. Si les urines sont trop foncées, ça veut dire que vous ne pouvez pas assez. Alors il faut augmenter la quantité d'eau que vous buvez. Si les urines sont claires comme l'eau, ça veut dire que c'est bien. Vos reins fonctionnent bien, il n'y a plus trop de saleté dans votre corps, il faut continuer à boire.
Pediatrics, we have over 1,000 children that were consulted.
So a child, I think it's about 6 months, one congenital malformation of the biliary tract. So we need a bit of investigation because now it's having the liver, the function is already decompensated. There's very little. You have mouth here, failure to thrive, everything is there, malnutrition. Because it's not absorbing, and this tool is the color, because it's not absorbing nutrients. So that's why there's this malnutrition, there's rickets, there's everything.
940 people received ophthalmology screening. Reading glasses and sunglasses were distributed as well.
A great learning experience for us. The people of the Western region have been exceptionally great. The recipients of our service. I really appreciate their patience, their understanding some of the shortcomings so far that we've had, especially in terms of supplies, and they've been really understanding. Based on what we've learned so far, I think we look forward to having assessing the situation and making some adjustments for next year. We believe that this has been a learning experience and next year will be much better, especially in terms of logistics and equipment and supplies. And for me, it's been really fulfilling personally, because I see the need and the people have been really so appreciative of the little that we've done for them. So I leave here very satisfied and so energized for next year.
Je suis très émue pour le travail que vous avez fait et que je peux pouvoir lire. Parce que quand on m'appelle même aujourd'hui, je dis que sans connaître la personne qui m'a appelé, je n'arrive pas à lire. Vraiment, j'en suis commissaire et je vous remercie beaucoup.
Je suis très content de cette consultation qui se passe pour nous aider. Je vous donne la force de venir toujours par moment nous aider, parce que tous les bars ne prenons pas de l'argent et que nous disons merci à ceux qui ont pensé pour nous. Que Dieu vous bénisse. Merci.
bangante anasi ma bawu bibi ho mi après a defo pre go say that mercy who na be say me for yasa de la we hele me di ma I dem I don't know for I no feel read some book again. I feel I put the lunette. I pray say God help me with the lunette. As he say I go see him, he go help me. I therefore make prayer for the all my begin them, for all matter them with them don't come help me for bangante. Make God go bring them for them go bless so fair. Who I think the man we don't remember for them fighting for come hello be for bangante.
Also, this year we were privileged to consult with prisoners at the Baffin prison. 50 consultations took place at the prison and 4 surgeries as well.
Je ne m'attendais pas que ça devait être ainsi. Donc, bref, j'avais peur, j'avais vraiment peur. Donc, je ne savais pas que après l'opération, je devais me sentir soulagé.
Pharmacy, which is usually our busiest department, saw over 3,600 people come through, and we're estimating an average of 3 to 4 prescriptions per person. So that's quite a number of prescriptions that were filled. Each one of them were double and triple checked for accuracy, and patients were counseled as well about how to take their medication. So we provide comprehensive services every year. This year has been no different, and I'm just so very grateful to the team that we have. They're very dedicated. We had the 2 pharmacists that came with us from Washington, D.C. We have some very challenging cases, but we have very able surgeons. One more case I believe is going to go to Ascobain in Yaoundé. This is a boy who was born without an anus, and he's currently using an ostomy bag. Dr. Boyle has agreed to perform his surgery for free as well. And we also have a lady who is kind of advanced in age. She has very severe chronic vaginal and rectal prolapse. We were not able to perform the surgery on site, and Dr. Boyle has also opted to take her to Yaoundé and perform that surgery as well. So we're very grateful. We had 2 or 3 hysterectomies this mission. We had, of course, a lot of hernia cases that present, and those are really easy to take care of. We had lipomas, those were taken care of as well, and a few more challenging cases.
It's been a wonderful experience, actually. Lots of surgeries, and keeping busy, saving lives, one person at a time. Yes, I had to do a hysterectomy yesterday with minimum amount of instruments, and it was challenging, but at the end of the day, it was done. It took longer than expected.
Je remercie l'ONG Patcha. Je suis très fier parce que je vais vous dire que je suis venu ici en 2015. On a examiné l'enfant. Après avoir examiné, on m'a envoyé à Babsam pour faire l'échographie. On a fait l'échographie. On m'a dit qu'on doit opérer l'enfant. Lorsque on m'a dit qu'on devait opérer l'enfant, je rentre me préparer pour qu'on opère l'enfant. Voilà que sa grande sœur casse son pied en deux. Qu'est-ce que je pouvais faire? Il faut que je regarde sa grande sœur qui a cassé son pied en deux. Alors, le chef supérieur, roi de BAGULAP, je le remercie 1000 fois plus parce que il nous avait dit qu'il y a un ONG qui doit nous visiter au niveau du nez. Je remercie le président Paul Biya, je remercie le ministre de la Santé, je remercie cette société. Vraiment, j'avais déjà demandé là où je vais prendre de l'argent pour traiter cet enfant. Je remercie beaucoup 1000 fois plus parce que vous êtes là pour aider les pauvres. Je remercie, je suis très fier. Je vous remercie. Bon pied la route.
our teams is unique, and each team member comes with the knowledge that it's going to be a hard week of work. Nobody comes in slacking. The surgical team is very, very busy. This year, we had 2 teams going simultaneously. We had the Ascobin team and we had the Presbyterian Hospital of Dogbati as well. I believe they performed over 60 surgeries, and a few of those cases were very challenging. Today, actually, I was in the hospital in Dogbati visiting a boy, a 7-year-old boy who was brought into Douala to receive his surgery because we were not equipped to perform it on site. And I'm grateful to announce that Dr. CAMEROON was able to perform the surgery for free on behalf of the family.
C'est pour vous remercier de ce que vous m'avez fait, maman. Grand merci. Je sors comme ça de Banganté. Moi, je ne savais pas que... je ne savais pas, l'enfant était avec sa grand-mère au village. C'est quand vous êtes venu en campagne à Banganté que on m'a donné l'enfant en vacances. On m'a dit que vous êtes venu en campagne à Banganté, que je suis venu avec l'enfant. On m'a transféré de Banganté pour Douala. Je n'avais rien. Mais le docteur, ou c'est le docteur comme Monsieur Théophile a dit que oui, qu'il va prendre les engagements, maman. Grand merci. Je vous remercie.
Je m'appelle Happy Charles. Je remercie très sincèrement, franchement, le Patcha Foundation. Nous sommes contents et c'est notre souhait quand des choses comme ça sont organisées pour aider les démunis. C'est une très bonne chose. C'est pour ça que je suis vraiment très content et je dis très grand merci.
Oui, je suis très vraiment content de cette opération parce que depuis plusieurs années que je sais mal, je me posais toujours la question de savoir comment je vais faire parce que c'était tout juste au niveau vraiment des nerfs qui montaient au cerveau. Et je me disais que peut-être en opérant, ça pourrait me causer beaucoup de là, que tout et chacun a besoin vraiment de vivre. Et je me disais que peut-être en opérant, ça pourrait vraiment jouer. Mais je dis merci vraiment d'avoir organisé vraiment cette cérémonie pour pouvoir nous permettre, surtout aux gens devenus comme nous, de vivre vraiment encore vraiment en paix et dans la joie. Je suis très content pour cette opération.
A medical mission of this nature cannot be successful if we didn't have the sponsors that we do, if we did not have the volunteers that we do, if we did not have the members that we do, and of course if we did not have the community supporting it the way that it has. This year we were lucky to have the chief of BANA, who was an organizing partner of the mission. He really championed this mission from start to finish. We had the chief of BAGULAP, who sponsored the mission in Banganté because we had no support from the Banganté community at all, unfortunately. But lucky for us, the chief of BAGULAP stepped in and that helped a little bit. We had also Monsieur and Madame Siwe, to whom we are so very grateful. But we're very appreciative of all of our sponsors, all the volunteers, all the donors, all the members of the foundation. We couldn't do it without you. God bless you, and we hope to see you all back again next year.